So there are a lot of comorbidities also associated with FND or functional seizures. The first step is to address those comorbidities like anxiety, depression, PTSD, chronic pain syndromes, things like that. But to address comorbidities, yes, they are not the direct treatments for NEE, but addressing them is important for all people with functional seizures.
Did you know that heaps of people with an epilepsy don't only have that, but also have functional neurological disorder, FND, or non-epileptic events? And already I'm like, one is enough, thanks. But these diagnoses do unfortunately often come hand in hand. So now we ask, what actually is FND, non-epileptic events? Lots of us have no idea we experience one or the other, or that our patients may have them, because we don't know what they are and what are the symptoms. Good news for today. This week we have the fabulous epilepsy specialist neurologist Dr Parthvi Ravat joining us to help us all learn a little bit about the disorder. If you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get way more people around the world learning facts about the epilepsies.
Yeah, I'm Parthvi Ravat. I'm a neurologist trained in India, and I'm currently undergoing my supervised 12 months of practice to become a neurologist in Australia. My special interest is epilepsy, and I try to do a little bit of research along with seeing my epilepsy patients, which is my passion. Epilepsy is very close to my heart, and I'm very glad to talk to you today.
Very closely related to epilepsy, although different, is FND or Functional Neurological Disorder. So could you tell us all about this condition and how it relates to epilepsy, please?
So functional neurological disorders are essentially the gray zone, which we're learning more and more about it. It's something which we don't structurally see on the conventional diagnostic techniques like MRI or CT scans or EEG, but it doesn't mean it's not there. It is essentially a disorder of your mind or even the brain, because there are some functional changes seen on your PET scans in functional neurological diseases also. It's basically a way that your software is not reacting correctly to whatever triggers that are coming to you. I always use this analogy for my patients, hardware and software. So, for example, we know epilepsy is a hardware problem because there might be structural troubles or metabolic troubles, genetic troubles, which lead to epilepsy, or another millions of things that may lead to epilepsy, but that's essentially a hardware problem. Similarly, functional neurological disorders, and specifically functional seizures, is a software problem. So it might not be very visible, but it's definitely there, and there's a lot of ways to tackle them. And why is it so related to epilepsy? Because it's a very common comorbidity in people with epilepsy. And why talk about functional neurological disorders in relation to epilepsy? Because it's a very common comorbidity that we see in persons living with epilepsy. It's a very common experience. Almost 30 to 50% of people living with epilepsy have experienced functional seizures, which is not a small thing, and it has immense impacts on the quality of life and on various aspects of your life. So it's important to have a discussion about it, to know about it, and to be literate about what it exactly is. And the most importantly, that it is tackleable.
And what are the symptoms of functional neurological disorder?
As you know, DSM-5, that's the diagnostician and statistician's manual, that they have laid out of specific criteria for it. It's a established disorder, functional neurological disorder, which encompasses various things, including motor symptoms or the lack of thereof, such as loss of power or the ability to move your limbs or the ability to talk, or sensory positive symptoms like having some paresthesias in your body, tingling and numbness, or just a trickle somewhere in the hands or legs. So those are motor functional symptoms, sensory symptoms, and then we have functional seizures, which come under the umbrella, might look like a seizure, but might have some nuances which differentiate them from true epilepsy or true epileptic seizures. And essentially, functional seizures is a term that has now been debated, and now they've recently come up with this term called NEE, or Non-Epileptic Events, because we know they are not seizures, but they're just non-epileptic events. If you call it seizures, it still gives you a flavor of epilepsy, which it's not. So that's one more symptom besides motor, sensory, and seizures. Sometimes it can also encompass cognitive symptoms.
Okay, so it's something that can be felt physically, psychologically, combination of both, alongside the neurological epileptic seizures. I know somebody who developed NEE or non-epileptic events, and he has an epilepsy, and in the beginning he didn't know the difference. We spoke about the potential and he spoke to his clinician about it. They were like, actually, that's not an epileptic seizure you're experiencing at this point. It's a NEE. And he was like, oh gosh. And he felt a bit like, is this like kind of fake or something? Because he wasn't familiar with it. And I think that that's something experienced by quite a lot of people with NEE.
Yes, absolutely. And I get a lot of patients in my clinic who say that my friends and relatives, my own family who live with me, keep on telling me that, oh, you're faking it, oh, not again, she's gonna do that again. But that's not true. It's just your body's response to something that might be triggering the non-epileptic event, and it's not in your control. Of course, non-epileptic events might develop, the whole pathophysiology might be fed by sometimes people who have epilepsy might have seen someone having a seizure, and then their subconscious knows that this might be the way to manifest it. This is a good published paper for it, where they discuss how the whole non-epileptic event psychology develops and how they are fed by if they've seen a relative with epilepsy, or if they have had epilepsy in the past or are still having it. So it's not that all people with epilepsy will develop NEEs, but people with NEEs might have been in some touch with someone who's had epilepsy, or might have seen someone or personally experienced epilepsy, and that might have fed their schema of developing non-epileptic events. And then whatever happens to them, but it's not them doing it. It's their body's response. It's not voluntary. It's not in their control. And what is in their control, though, is how to tackle it and how to treat it, and maybe to talk about it to a neurologist, a psychologist, a psychiatrist. So it's a multidisciplinary thing, of course. No one person can help you treat it. But yeah, a good team definitely helps you get on top of it.
And a multidisciplinary team, again, which is something similar to epilepsy as well, because of the psychiatric morbidities. So how does one often treat this condition effectively?
So there are a lot of comorbidities also associated with FND or functional seizures. The first step is to address those comorbidities, like anxiety, depression, PTSD, and a lot of other chronic pain syndromes, things like that. But to address comorbidities, yes, they are not the direct treatments for NEE, but addressing them is important for all people with functional seizures or NEE. That's the first thing.
Is that because those other comorbidities play an important part?
Yes, to some extent. We don't exactly understand how it's related, but there have been studies which have shown that people who might have had PTSD have a little higher tendency to develop NEEs as compared to the general population. So that's an association. We don't know the exact relationship, but that's one part of it. The other thing is to cognitive behavioral therapy, to address the psyche behind it, the software that now needs to reset. And it's a brilliant thing, because once you start talking, you know what's happening and where is all this generating from, and you can address it, but it has to happen under professional guidance.
What about preventative measures? Is there a way to do that for NEEs?
I'm not sure about how to prevent NEEs, but that's food for thought for a lot of people working in FND area and policymakers, because there is a lot of overlay of unaddressed psychiatry issues. So yes, more talking, more destigmatization of mental health troubles, earlier talking can help maybe prevent the psych from developing into something NE. But I think the discussion is steering more towards that the psychiatry is involved more towards functional seizures. But I do want to say that a lot of psychiatry is involved, but it's still a disorder with an organic basis, that there is some functional abnormality, which is why you're having these manifestations, which another person with the same triggers or same stressors might not have. So it's not like it's completely in your head, but we have a long way to find out things about it. A lot of good studies going on, but there's this paper called Codes, and they talk about how cognitive behavioral therapy has helped in tackling functional seizures, and it did make a significant improvement at the end of the period of their study. So when you ask the treatment question, besides addressing the comorbidities, cognitive behavioral therapy, and also regular follow-up, having your team of doctors involved in your care, just not saying, okay, bye, we met 3 times a year and now bye. So no, just making that a thing even after you're well and not had functional events for quite a while, at least once in a while, just say hi and just check if everything's fine.
I imagine something like this, again, like with an epilepsy, there could be a resurgence of the seizures they experience at some point in their life.
Yes, so similarly, if one knows the triggers, then they will be able to avoid them, but sometimes you can't avoid them. So they did a study and found out that all people with NE will have either one of the 3 outcomes. When you tell them that they have NE, 1/3 will be fine. Okay, I'm so glad I don't have epilepsy because I don't want to have epilepsy. And so they might just stop having those events altogether. That's the first third. The second 1/3 are the people who will accept it and will be willing to take cognitive behavioral therapy or address the comorbidities or be in regular follow-up and talk to their friends and family about what it is, get them involved in their care, and then, basically deal with whatever has come their way. And the third is the one whom we don't know. They just continue having these functional events, and we still have to find out better therapies for them, but they don't respond to any of the therapies that we currently have for functional seizures. So, and it's like, I always tell these to my patients that I know about these seizures because it's like when you're trying to type duck and your phone just autocorrects and you just can't type duck. So it's difficult for them, but my heart goes out to them, and I usually take them because I do first seizure clinic. A lot of seizure mimics, these are one of the good seizure mimics. They fall into the category of seizure mimics, and it's important to classify them as not having epilepsy because a lot of people have that fear, and once you tell them, okay, it's not epilepsy, such a sigh of relief.
It's like, for instance, I know somebody who has NEEs and he is debilitated by it. And he also doesn't have an epilepsy, but it appears his treatment hasn't been successful. So I do see how it can be equally actually debilitating to have these NEEs as it is for epilepsy. So although I guess I get why people say, oh, thank goodness it's not epilepsy, but it's not necessarily an easy thing to address on its own.
The thing is, we do have, in epilepsy, we have the 1/3 who's only, you might have to go for surgery for those 1/3. In the category of functional seizures, these 1/3 are the ones whom we still aren't able to offer anything. So maybe with science, maybe 10 years down the line, we'll talk again, and then maybe I'll tell you, okay, we have something for them.
Thank you to Parthvi for sharing such empathy, passion, and insight into the challenges of people affected by FND or non-epileptic events. Check out more about Parthvi at the website torierobinson.com, where you can access this podcast, the video, and the transcription of the entire episode all in one place. And if you're new and you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get way more people around the world learning facts about the epilepsies and what often comes with the epilepsies too. See you next week.